In local matters, we are taking a closer look at Texas, where Governor Greg Abbott has paused plans to reopen the state. Over 10,000 new infections were reported in the last 2 days alone. The total number of confirmed cases is more than 128,000. Today, Governor Abbott issued an executive order for hospitals in 4 counties to stop performing elective surgeries. It aims to free up hospital space for COVID-19 patients in Dallas, Houston, Austin, and San Antonio. Renu Rayasam covers Texas politics, policy, and healthcare for Politico. She joins me now from Austin. Thanks very much for being with us, Renu. Governor Abbott began lifting the stay-at-home orders at the end of April. Do we know what's behind the spike in cases?
Well, I mean, it's clear that as social distancing restrictions have been lifted, more people are out and about. We're going to see more cases. I think that's something that was expected. But the surge in cases and the rate at which it's rising is showing that I think people are out and about and probably not wearing masks or hand washing and sort of following a lot of the guidelines that the CDC has outlined. And that's probably the most likely reason behind the recent surge in cases.
So the Trump administration is ending its financial support for 13 drive-through coronavirus testing sites at the end of this month. Is that effectively slowing down testing, as the president said at his Tulsa rally?
Well, so a lot of those sites are in Texas, and the president said he's slowing down those, that he was ending the federal funding for those sites, and that federal funding will end at the end of June. There's still a lot of testing sites out there, and the state is making up some of the funding for those testing sites, and a lot of cities and counties are trying to prop up their own testing sites. But for sure, the Trump administration has left a lot of states and then cities and counties on their own to do this. And this is at a time when it's important to get a real handle on these outbreaks. So the Trump administration has said, and then the president himself has said, that testing is to blame for some of the surge in cases. But there's some other numbers to look at. And when you're looking at the numbers in Texas, like I said, of course, as social distancing restrictions lift, as testing rises, as more people are out and about, you're going to see a rise in cases. But we're seeing some other really alarming numbers that are showing that it's not just a rise in testing that's to blame for what's going on right now. One of those is something called the positivity rate. This is the sort of technical, but it's the rate of positive cases to overall cases. We're also seeing hospitalizations rise, and we're seeing a lot of cities and counties in the state worried about not having enough hospital capacity to treat coronavirus patients that are showing up sick to their hospitals.
I want to dig in a little bit later into this concept of more testing in a minute. But earlier this week, Governor Abbott said that too many people there are not taking this seriously. Let's listen to some of the guidelines that he recommended.
First, we want to make sure that everyone reinforces the best safe practices of wearing a mask, hand sanitization, maintaining safe distance. But importantly, because the spread is so rampant right now, there's never a reason for you to have to leave your home unless you do need to go out. The safest place for you is at your home. Second, we are increasing enforcement.
So we just heard him say that people need to wear masks, but he is not allowing local authorities to mandate face coverings. Is there any plan to bring back any of the restrictions that were in place during the stay-at-home order?
So right now, yes. And the governor has sent a lot of mixed messages, I think, on this pandemic, and in masks in particular. And his tone has become a lot more urgent in recent days as we've seen cases and hospitalizations skyrocket around the state. And mask wearing is one of sort of the biggest sources of confusion right now. So I think he had an executive order saying that local counties, cities couldn't mandate mask wearing. But then in recent days, he's completely reversed himself and allowed counties to do this sort of workaround where they can allow businesses to do mask restrictions. So basically what a lot of cities and counties are doing now is they're requiring businesses to require customers to wear masks. So it's a little bit confusing, but San Antonio was the first to do that. Fort Worth, which is a city that has a Republican mayor, instituted that mask requirement today. So it's been a little bit confusing, the messages we've seen from the governor, but that's supposed to be in line with the early executive order, but he signaled that he's not really keen to reimpose any kind of restrictions or stay-at-home orders. But it's still to be seen. I think what might happen is he's going to continue to defer to local leaders on some of these measures. I spoke to the top elected official at Harris County. That's the county that includes Houston. I spoke with her yesterday. She said she's talking with the governor right now about whether to impose additional pandemic-related restrictions and whether they can have the authority to have some kind of enforcement mechanism with those restrictions rather than just making them recommendations. So I think it's true we're unlikely to see any kind of statewide mask wearing orders or statewide restrictions, but I think we're seeing sort of more local leaders wrest control away from Abbott and trying to impose some of those restrictions themselves.
Back on this notion of increased testing. So the president says the rise in infections is related to increased testing. Is there any merit to that argument? Because I recall reading in one of your pieces, Renu, an expert talking about the fact that if that were the case, why is it that in some states like New York and New Jersey, for instance, you're seeing the actual number of cases going down even as testing is going up at this point? So is there merit to that argument that these increased cases, the rise in infections, is related to increased testing?
Not really. I mean, there's a number of other metrics, like I mentioned earlier, that cities and states are looking at. And I mean, yes, if you have increased testing, sure, you're going to have more cases. But to suggest that the rises that we're seeing in Texas and then Arizona, Florida, places like that is due to increased testing is not accurate. Like I said, there's a couple of other measures, this positivity metric that states are using, that has really grown. We're seeing hospitalizations grow. And you're right, in New York, New Jersey, Rhode Island, we've actually seen testing increase while we're seeing the number of positive cases decrease. So there's not really much merit to the argument that testing is behind these spikes in cases. In any case, I think testing is really helping us get a handle on how bad some of these outbreaks are, and increased testing will really, I think, give us a better picture of what's going on and whether there's a surge in cases and where we are seeing outbreaks. So if anything, I think more testing will just give us a better picture. It's not really obscuring anything.
All right. Renu Rayasam. Renu, thank you very much for joining us.
Thanks for having me.